You're listening to Online Pet Health Podcasts with Dr. Megan Kelly. Continuing education for veterinarian rehabilitation therapists. Learn more at onlinepethealth.com.
Hey vet rehabbers. Now this is a topic which I did not learn at all about in vet school. Now Amy King joins Anae in this revisit of a recent Facebook Live to discuss the prevalence of canine hypermobility in canines. Amy presented a webinar in the hydrotherapy membership on this fascinating topic. Onlinepethealth paid hydro members, you can access it in the library together with the other 82 hours of training available to the hydro specific members. Now, I used to call this floppy dog syndrome. We all recall these German shepherds that come into the practice with these super lax ligaments, and it seems like they have torn ligaments in every joint in their body. And we discusses what hypermobility looks like, how it connects to mental and emotional imbalances like anxiety, noise sensitivity, fear, as well as how it might affect athletes. This was a super interesting conversation, and that webinar is one of the all-time best trainings this year in the Hydro membership. Before we head over to Amy and Anae, I'd love to connect with all of you on Instagram, so please take a screenshot of this podcast, post it on Instagram and tag me at Onlinepethealth, and let's get connected. It's so great hearing from all of you and knowing you're joining me each week listening to the Veterinary Rehabilitation Podcast. Now, we created a special pool water management checklist for all our hydro vet rehabbers. It's what you should be checking on a daily, weekly, monthly, and yearly basis. Now, I'm really embarrassed to say that when I had my underwater treadmill, I did not do half of those checks. But the reason was I just didn't know how serious it was if I didn't, and I didn't know what I needed to do. That's why we created this checklist for you. So if you want to get hands on a copy of this checklist, you can go to www.onlinepethealth.com/water tests. I'll repeat that, onlinepethealth.com/water test. Over to Amy and Anae.
Hi everyone, and welcome to today's Facebook Live. Welcome, Amy.
Hi, thanks for having me again.
That's awesome. So guys, thank you so much for joining us today. We are going to be chatting about hypermobility in dogs, which is such an interesting topic. And then there is a webinar on hypermobility that Amy presented not too long ago in our Hydro members portal. And it is phenomenally interesting. So if you have any patience with this, if you're interested in really diving deeply into it, definitely watch that webinar. It is so interesting. It had me sitting on the edge of my seat throughout. I learned so many new things. So just as to put it out there, I'm going to ask Amy to please introduce herself to us. And what is your interest in hypermobility? How did you learn about it and become interested in it?
Well, thank you for your comments on my webinar. It's really nice to know that it's interesting for other people as well. I am an ACPAT physio and I work in the wing clinic in Wellington in the UK. And I have been working as a human physio for 10 years this year, which feels like it's gone in a flash, but also like a lifetime. And then I went and did my MSc in veterinary physio and qualified with my PG dip in 2018, but left it a couple of years to try a topic for my research project that I would be interested in and that hopefully might try and answer a question that we come across in clinical practice. And I guess I'd come across hypermobility in my human practice, but maybe not a great deal, just something that I would find incidentally. It wasn't an area I specialized in by any means. But in the canine work that I do, I think we do come across it quite regularly. And yeah, so I wanted to do my research project for my master's on hypermobility. So I started having a look into it, and there's very little information or research out there on hypermobility in dogs, especially when you compare it to the wealth of research that we now have on human hypermobility. And I think we treat a lot of working dogs and agility dogs specifically at the wing clinic, and it seems to be a presentation that we're coming across again and again. So I would assess I think these dogs are quite mobile, but we have no objectified assessment tool to assess for that in dogs. And in humans, we've got the lovely Baton score, which is a 9-point score. I'll whiz through it quickly just in case you don't know about it, but it is a really quick, It's easy to do in any clinical environment, school, that you can do on yourself or you can do it on someone else. And it just looks at the joint range of 9 joints. So if your little fingers bend back to 90 degrees, your thumbs will touch your wrists, and elbow extension past 180 degrees. 90, knee extension past 180 degrees. And then if you can get your hands up to the floor without bending your knees. So that gives you 9 joints with which to score. And if it's 4 or more out of 9 for mobile, it's so straightforward. And what would be great is if we could have something like that for dogs. But obviously in dogs, we've got the breed variations and conformations and different ages and pathologies. It's just so much more complicated. So that's what I wanted to try and base my project on. Basically, that's where I got into it, and hoping that we can kind of start working towards having something like the Baton score that we can use for dogs to try and identify associated pathologies like hip dysplasia and patellar luxation and screen for them really early to try and help pick up some of those conditions before they become too much of a problem. But also, I think just in day-to-day clinical practice, it helps us to manage our prognosis for treating a lot of the dogs we treat, because sometimes you're treating a dog and it's not getting better, and it presents with this and then it presents with that, and there are some other bits and pieces going on, and then you realize it's hypermobile. So I think it's really useful clinically, but it's definitely a conversation that needs to be wider spread, because a lot of vets perhaps necessarily consider it because there's not enough clinical research behind it yet. Sorry, I've talked for quite a while there.
No, that's fine. Thank you, Amy. I think that's it is very interesting. And I don't only think that it's vets that don't consider it, because to me, it's never really been something that I've thought about either in practice. I wasn't working with canines only for a very long time, but like you said, there's so much variation within breed that I would just look for a normal for this dog. And if that's quite mobile, then that's his normal, right? So it was really, really eye-opening to me to look at not only hypermobility is not only about the joints that are hypermobile, but it affects the rest of the body in detrimental ways as well. So that's really interesting. So Amy, let's chat a little bit more about what hypermobility actually is, and what we should be, how it relates to hypermobility in people. So how do people and dogs relate to one another?
Yeah, so I think even in humans, it's quite complicated and potentially a bit of a spectrum. So at one end of that spectrum, you might have those really severe hypermobility syndromes like Ehlers syndrome and Marfanoid syndrome, where individuals, it's quite a debilitating condition, and they will struggle with things like spontaneous joint dislocations and hypertension and things. And then we use the Baton score to identify generalized joint hypermobility. But generalized joint hypermobility is a term that we can kind of use to identify sort of incidental hypermobility. So it might be in a person who is asymptomatic, and I'm sort of unquoting that because they are asymptomatic for maybe joint pain or any of the kind of associated presentations that can come with hypermobility, but also there's still an increased risk of those things by being hypermobile. So that's generalized joint hypermobility. And then there's that other area of sort of joint hypermobility syndromes where they have the joint hypermobility, but also some other associated complications. And we use something called the Brighton criteria to help us to identify that. And that looks at things such as, takes into consideration chronic pain, multiple joint pain, and varicose veins, herniations, prolapses, and skin striations, other things that are associated with hypermobility. And the reason for that is because fundamentally it is a problem with the collagen. And the study that I used as a real stepping stone to plan my research was a project done by Ueda. That's how I say the name. And they did a study in 2018, and they did biopsies of the patellar tendon, and they looked at a control group and a patella luxation group. And they found that in the patella luxation group, they all had really high skin elasticity. And the biopsies of the patella tendon showed basically collagen dysplasia. So the collagen fibrils were much thinner and they were much more sparsely distributed rather than that kind of uniform distribution that we want in our collagen. So that just means that everything made of collagen is just that bit laxer. And as we all know, collagen is everywhere. So it makes up something like 73% of our dermis. It's in ligaments, tendons, connective tissue, fascia, blood vessels. So it can affect us in a myriad of ways because that's the pathogenesis of it. And also explains why it's a genetic, inheritable condition.
Wow. Okay, that's amazing. Okay, so we have some really great, easy, clinically applicable ways to measure in people to look for both if they incidentally have hypermobility, where it's not, like you said, it's kind of not actually affecting them, right? It's not negatively impacting them, but they're at increased risk. Do we have anything like that in dogs? And yeah, let's talk about how we can look for it in dogs.
So luckily for me, the skin extensibility index is already pretty well established. We don't use it much. I don't think I'd come across it before doing this, but I think somebody invented it in 1987, and it's associated. They used it for identifying Ehlers-Danlos loss in dogs. But obviously the group of patients that clinically we're looking at are not those kind of drastic EDS dogs. They're more generalized joint hypermobility kind of dogs. And then obviously Ueda et al. In 2018 also used the skin extensibility index to measure skin elasticity. And then they associated it really strongly with the patella tendon biopsies and patella luxation. So they'd already done quite a lot of the groundwork. And skin extensibility index is really straightforward to, well, I say it's straightforward. If you've got a dog that'll stay still for more than 30 seconds at a time, it's pretty straightforward. But you just measure the height of a skin fold. So you lift the skin fold over the thoracolumbar spine and you measure the top of the skin fold back to the body. And then you divide that by the length of the dog from the occiput to the tail base. And then you times that number by 100, and that's your skin extensibility index. And that's a percentage. So a normal range is about 6 to 10%, and anything over 14.5% is considered elastic. So that's a significantly high skin elasticity index.
That's very interesting. Has it kind of been tested across breeds?
Dogs and cats.
Dogs and cats. Okay.
Yeah, no, we have a skin elasticity measure in humans as well, but I actually don't know whereabouts we measure that, and I don't know what the parameters are. So
no, that's fine. Okay, so let's chat about some of the other ways in which hypermobility will affect dogs, because collagen is everywhere. So you've mentioned already that it's been correlated to patella luxation. What else could we be seeing?
So it creates a bit of a clinical picture, and in humans they're really building that picture and associating it with things like neurodivergency. So there's a really super doctor, I think she's in the southeast of England somewhere, called Jessica Eccles, and she is doing a lot of research into neurodivergency and hypermobility and taking brain MRIs and finding that the amygdala is presenting differently in hypermobile individuals and linking it to ADHD and anxiety, autism, chronic fatigue and chronic pain are all really significant. And also what I think is really, really relevant, touch and sound reactivity, or sensitivity, we would call it in humans rather than reactivity. And I think that makes up part of the picture in dogs as well. And there's that really big study that most people have heard of if they're talking about hypermobility in dogs. I think it's more than 5,000 dogs that they're in their cohort for that study. The Bowen study that they did in 2019, looking at service dogs with hip dysplasia. So they use the hip dysplasia as like a objective marker for hypermobility. And then they investigated over-arousal or excitability, and they found that strong correlation. So it mirrors what we see in people as well. And then from a more MSK point of view, it's associated with reduced proprioception and difficulty building and maintaining muscle bulk and increased risk of soft tissue injury and slower recovery. So all of those sorts of things. And I think often you get owners coming in and saying, I think my dog's just really clumsy. And there's that link to dyspraxia, and dogs that will sleep in bizarre positions, like upside down with one leg on the arm of the sofa and their neck at 90 degrees. And again, I think that's part of that wanting to try and find an end feel, because their proprioception is just a bit skewy.
Yeah, I mean, that is so interesting. So really, when we're looking at our patients, if we're not going to be kind of specifically looking for hypermobility, the flag should be going up when we see things like you said, clumsiness, if we have other orthopedic conditions, if there's reactivity to sound or to, to stimulus, noise, or touch. So those kinds of things. Are there any other flags, if I can call them that would make us think, okay, maybe there's more going on here than just the whatever primary thing we're looking at?
Yeah, so those subjective markers for me are the kind of that anxiety or reactivity, and that could present, in so many different ways. But if you have a dog that maybe is demonstrating some sort of behavioral issues, sometimes that can be linked. And then touch sensitivity. So a really common one is she doesn't like having a harness on, or she won't tolerate a harness going over her head, or doesn't like having a collar put on. And this could be in dogs that have never had a known adverse experience to these kind of things, or doesn't like being groomed, that sort of thing. And then the objective side of that assessment would be the skin extensibility index, which is really easy to do in clinic. And then my research project was trying to develop some association to joint range with the skin extensibility index. So I measured shoulder abduction angles and stifle extension angles, and found that those with higher ranges had higher skin elasticity index, which we probably would expect, but it's nice that it was clearly correlated. So I also look at those joint angles, and I know that's a little bit, the only research there backing that up is mine, and it was in a small cohort, 22 dogs, but it was consistently correlated across the group, and I think anecdotally we see that quite regularly. So I do look for those increased joint range parameters. And then I think
if you say increased joint range parameters, by how much are we looking at the stifle and shoulder abduction? Like how much more than normal?
So the average shoulder abduction in a high SEI group, so more than 14.5%, was 44.38 degrees, and the low SEI group was 36. So what's that, 8 or 9 degrees? So it's not enormous.
Okay.
But it's closer to the control groups for joint ranges. So there are a few studies that have tried to define what like a normal joint range for dogs is, and the low skin elasticity index group is closer to those figures, and the high shoulder abduction figures are much closer to a study that Cook did that looks at shoulder abduction angles in dogs with shoulder instability. So I think there is definitely a leaning one way and the other. Yeah, so I think what would be really cool would be to try and make this like more of an MDT assessment, so we could start drawing in things like positive ortolani signs and hip distraction index or pen hip scores, or think basically maybe even biopsies, but just to try and build up more of a picture of when our when our easy to use scores are tied into that pathology.
Do you think that we would have the same skin elasticity? Would it be an accurate test in a young dog? So if we're doing puppy evaluations, should we look for it then?
The honest answer is I don't know. No one's ever done it or done any research in young dogs. So that is where I would like to go next, because you're right. I think we need to be assessing and screening these dogs as soon as possible. And we know, hip dysplasia starts developing the first few months of a dog's life. So ideally we want these young puppies that we can assess, but all the tools we have now, which are relatively limited, or the research is all looking at musculoskeletally mature dogs. So we really need to go and do some research.
Yeah, that would probably be a good one for us to add. So if I'm just thinking about kind of, we all evaluate dogs all the time, and adding in that skin extensibility test, it would be pretty simple in a normal evaluation. It wouldn't actually take much extra time. So I would love to just kind of put out an invitation. I think it would be a great idea for us to start doing that in clinical practice, and start looking for this. And then we can just put together our evaluation data at a later point and say, yeah, this is what I'm finding in terms of skin extensibility and range of motion of specific joints, and just share that information with one another or publish further research. So I think that would be really cool if we could get more vet rehabbers on board to do that and to have that bigger pool of data.
Yeah, you don't need to convince me. I'd love that. That'd be great.
So I'm convincing everyone else, guys, who is keen to get on board with that. I think that would be really valuable. So in your lecture on hypermobility, you spoke quite a lot about athletes, and I'd love to tap a little bit more into that. You've mentioned that with the dogs as well, that it's often something that you find in agility dogs or competitive dogs. So share a little bit more with us about how hypermobility seems to affect that population that's competing or is athletic.
Yeah, so I'm going to dip my toe into the human research again here, because there is a physio who works with the Royal Ballet Companies called Moira McCormack. And if you guys wanted an interesting but not animal focused podcast to listen to, she does a really good one on the hypermobility, bendy bodies with the hypermobility MD. And she talks about hypermobility in ballet dancers. And it's just absolutely fascinating if you're a hypermobility geek like me, because she pulls out some really key points. So things like the prevalence of hypermobility in those professional dancers drops as you go up through the age categories, because those dancers can't cope with the increased duration and regularity of training without the recovery times as their careers become more intense. And there is also, she's sort of talking about research papers that they've done in the last kind of 10, 20 years, that the risk factors for soft tissue injuries are higher in the hypermobile group, and that the recovery times are slower, and they are more likely to need time off compared to their non-hypermobile counterparts. And what was really interesting for me is that she points out that her non-hypermobile dancers can go away and have a week, 2 weeks off and come back and get into training again with no repercussions. But the hypermobile group can't cope with that. And just a week off, and then they have lost a lot of condition, and then their risk of injury when they come back is much higher. And I think we definitely see that in our agility dogs. So a classic picture that seems to keep coming up again and again at the clinic is the working Cocker Spaniels. And I think this is a good time to say that actually hypermobility can be a real asset, because they've got these big movements. We want that big extension, and we want that big form and hind limb protraction and retraction. But equally, we have to know how to manage that. But I think that's where it's really important that we're assessing for how well they're managing that range of motion, given that their proprioception is reduced and they have much greater range to maintain strength through, which is hard. If you're hypermobile, you will know that. So the key thing is being aware of it in the first place, being armed with the knowledge that if you've got a canine athlete who is hypermobile, you need to work that much harder at their conditioning program, and you can maintain that even during off seasons. And if they're injured, you just need to be prepared. They will take longer to recover. And I think from our point of view, that's so important, because we're responsible for trying to manage owner expectations. And when they've got sporting goals lined up and you're there going, it might take another 3 months, you want to be confident in that knowledge before you make them wait 3 months before they can train again. But equally, what I'm starting to realize is that if we can catch them before they injure, and try and avoid all those secondary complications, all those helpful movements that they build up so quickly, and that and hypersensitivity that they build in faster than any of our dogs, and all of that. If we can catch them before that and make sure that they're as strong as they can be, then we can manage them that much quicker as well. Yeah, I had a dog that came to see us recently, and I found back pain, and the vet found a bit of back pain, but a bit of hip pain, and somebody else found some patella pain. And then we did the extensibility, and I was like, that's hypermobility. But the thing that made me assess the skin extensibility index is because the owner said, I rested him for 10 days and he was okay at the start. And after 10 days of rest, he was really lame. And I was like, right, I wonder if he's hypermobile, because he just dropped that condition in that time so quickly.
And like you said, that's so important for us to know, actually, because it really changes how the dog is managed, how the athlete is managed, how they're prepared for competition, and what their training schedule looks like will be very much affected by whether or not they're hypermobile. So I think in just in terms of that, understanding the implication on an athlete is really important for us. So I just want to put up this comment from Angela. She says, we could incorporate this easily into assessments at Greyfriars. And they have one golden retriever referral who definitely fits the ADHD profile.
Yeah.
Great. Thank you. That'd be awesome.
And I think it would be really good to have hypermobility screening clinics. I think that's something that we could set up reasonably easily.
Oh, I like that. I like that very much. Some screening clinics. Good idea. I would very much recommend, if you want more information on this, if you really want to understand a little bit better, to go and watch that webinar on our Hydro members portal. It is extremely valuable, very interesting. And yeah, Amy talks about all the research that she's mentioned here in much more depth. So go and watch that. Thank you, Amy, for your time. It's really been great chatting with you about this. I've very much enjoyed it.
Thank you for hosting me again to talk about this. I don't know if you've seen, but at the IAV RP2 symposium this year, there's somebody talking about canine hypermobility that's not me. So I'm really looking forward to that.
Oh, that's very interesting.
A human rheumatologist called Helen Cohen.
Very exciting. Okay, well, I'm going to join that one then. If I can, I'm going to go watch that lecture. All right, guys. Are we going to see you all at the IVRPT conference? It's going to be great. We're going to have a meetup there with a Vet Rehabbers meetup. It's going to be really cool. Bye, everyone. Thank you.
If you enjoyed this podcast, please hit the subscribe button so you get notified every time I load a new podcast. And please, if you get a moment, head over to Stitcher or iTunes and leave me a review. It's a really lonely job being a podcaster, and so the only time I get to hear from you or know that you're out there is when I get a review. And know that I read every single one of your reviews. So to those of you that have left reviews, I want to say a very, very big thank you. Every time we get a review, it really helps to get the veterinary rehabilitation podcast out there to all the vet rehabbers all over the world. All right, vet rehabbers, so if you are looking for more continuing education in the field of veterinary rehabilitation, head over to onlinepethealth.com. Go be awesome, guys.